Emily Drake is a passionate and innovative public health leader, a former contributor to the Huffington Post in the U.S., and invited public health speaker. Her writing and public speaking skills have been sought out by nonprofit organizations, healthcare providers, and the private sector in Canada, the U.S., and Australia. Emily currently lives in Halifax, where she runs her own consulting business, emilydrake.ca, works as a research associate at the IWK Health Centre, Nova Scotia Health Authority, and is a PhD in health student at Dalhousie University. Prior to this, she worked with Hope & Cope at the Jewish General Hospital, McGill University, as the director of their Young Adult Cancer Support Program. A social innovator, in 2013, Emily co-founded and continues to grow Adolescent and Young Adult Cancer Societal Movement, hashtag AYACSM, an active multidisciplinary community that is changing the way stakeholders interact and share information regarding young adults with cancer. I would also like to add that Emily is the recipient of our 2018 Brain Tumour Foundation Healthcare Professional Development Grant. And with these funds, Emily attended the CancerCon conference, which is a patient-focused event that had nearly 650 delegates from around the world. While the primary audience was young people living with cancer, other attendees included caregivers, healthcare professionals, nonprofit employees, and advocates. Emily spoke at the conference on a social media panel and also had the opportunity to co-lead a session focused on connecting patients living with metastatic advanced cancer with each other and important resources. Today's webinar presentation is titled The Psychosocial Needs of Young Adults and will highlight the unique needs of young adult patients and survivors. It will also describe relevant resources and online communities. And I will hand it over to you, Emily.
Yes, thank you so much, everyone, for tuning in today. So as mentioned, I'm a PhD in health student in the Faculty of Health at Dalhousie University, but I've been involved in the young adult cancer movement for almost 11 years now in various different capacities. So I did my master's thesis on the experience of sexuality of young adults living with cancer. I've managed multiple psychosocial oncology labs that did young adult cancer research. And as also mentioned, I was the former director of Cancer Fight Club, which is the young adult cancer support program at Hope & Cope at the Jewish General Hospital. And now I'm doing my PhD, and my doctoral dissertation is focusing on the psychosocial experiences of young adults living with metastatic and advanced cancer. So prior to starting this webinar, I just wanted to highlight and raise the fact that a lot of the research that I've done over the past 11 years in programming has been inclusive of all disease sites. So if I'm referring to cancer survivors, I'm being inclusive of those with brain tumors as well. And I just want to say that just from the beginning, just so I don't confuse anyone, I don't have anything that I'd like to disclose or need to disclose before we get started. So our learning objectives for today, I know you may all be from diverse backgrounds, could be oncologists or patients, caregivers, advocates. So I thought we'd start by defining young adulthood and talking about some of the psychosocial challenges that we know young adults face when they receive cancer or brain tumor diagnosis. And I'd like to specifically highlight two projects that we've done over the past couple of years, talk a little bit about online communities, and discuss other resources that may be of interest as well. So first we'll get into and talk about what is young adult. So young adulthood is defined as a period of when people are 18 to 39 years of age, and this is an age range that's used consistently and many different organizations do use this, especially in North America. But across the world, especially in the UK and Australia, we see some people use a modified version, 15 to 24 or 15 to 30 is what some people use for adolescents and young adults. So it is not really consistent across the world, but here in North America, we tend to stick to the 18 to 39. And young adulthood is a developmental period where a lot of things are taking place. So we're exploring our identities. We may be moving out of our parents' houses. We may not be on their health insurance anymore because we're in that transition period. We're starting to develop our own financial independence, developing intimacy, learning how to date, be sexual, and define our sexual orientations and sexuality. We're considering or starting to have children in our families. getting married, and beginning our education and or careers. So in Canada, what we see is approximately 7,600 cases each year of young adults being diagnosed with any form of cancer in Canada, which is, as we know, the second largest country in the world. So this is still considered a minority oncology population. And what we've seen over the past decade is that the AY cancer movement has been a consistently strong advocate for the needs of this health population. So it's gained considerable momentum over the past 10 years, because back in 2008, when I was starting my master's thesis, there was little consistency around age definition. As well, people weren't as much as they are today, recognizing it as a own distinct oncology population. But since then, we've had a lot of advocates who have founded their own organizations, such as Stupid Cancer, Young Adult Cancer Canada, who really have been rallying for the young adult cause. We've seen the founding of the Journal of Adolescent Young Adult Oncology back in 2011. CPAC, the Canadian Partnership Against Cancer, has started doing some young adult cancer work, and much more program and research is taking place today. However, it's still an understudied area, and this was identified by the first ever Canadian governmental report by the Canadian Partnership Against Cancer back in 2017, which said that it is an underfunded area, which receives around 1% of cancer research funding. And there's a great deal of research we still need to do for this population. It also highlighted that young people often receive a delayed diagnosis. They may delay seeking help or ignore their symptoms, but young people also face barriers to getting a diagnosis sometimes as well, such as they may not have access to care through primary physicians, or healthcare providers may also be less likely to consider cancer in this age population, because like I did say, it is still a rare diagnosis. We know that young people also face a lack of age-appropriate care. So the adolescent young adult population tends to fall between the pediatric and adult healthcare systems, which of course are designed for people much older than them or people much younger than them. But yet we haven't really, through research, defined completely what is age-appropriate care and what is it that we're missing. We also know that young people have low participation in clinical trials as well. So young people face a serious diagnosis at a time of critical development. So their cancer or brain tumor diagnosis is coming at a time when all these different life events are taking place. And when we talk about the needs of young adults with cancer, we're not saying that their needs are more important than people older or younger than them, because certainly a brain tumor cancer diagnosis at any age may be difficult for the patient or their family. However, what we are saying is that these needs that they have are complex because of the educational, vocational lifestyle needs of this demographic period. And not achieving some of these developmental tasks required for transition to adulthood can make their survivorship needs complex as well. We know that young adults, depending on their diagnosis and their treatment, may receive late effects of their treatment. They may develop secondary cancers depending on what cancer they were diagnosed with. One thing that comes up a lot in the literature is a feeling of isolation. So being a young person and going to an adult cancer center, you may be getting surgery and waiting in the room with people much older than you. You may try to go to a support group and be with people much older than you, your grandparents' age. Additionally, you may also find difficulty finding emotional support with your peers who aren't living with a brain tumor or cancer diagnosis. They may not understand what it is that you're going through. We all know that treatment can take sometimes several years. Some brain tumors may be inoperable. You may have to deal with late effects. And so some people, after a couple of years, how come you're not better yet? They may not understand what it is that you're going through. So a lot of people do tend to connect with peers who are living with a brain tumor, who are living with a cancer diagnosis, to connect with someone who gets it, who understands what it is that they're going through. Young people also may have to deal with a loss of independence. Some may move back in with their parents if that's an option. It's not for everyone, or may have family or friends have to take care of them. But I wanted to specifically in this presentation highlight 2 of the studies that we've done to talk about what it is that we've found. And I'm going to start first by talking about a return to work project that we recently conducted. And this was published in the Journal of Adolescent Young and Oncology just a couple months ago. And it was funded by the Beecher's Hunter Cancer Research Institute here in Atlantic, Canada. And the primary investigator for it is Dr. Robin Urquhart of the Nova Scotia Health Authority and Dalhousie University. And so for this project, we want to explore young adults, so again, those 18 to 39, perspectives on and experiences with employment during their return to work following primary treatment. And by primary treatment, I mean surgery, radiation, or chemotherapy. And this was an interpretive phenomenological study. So we're looking at the shared meaning and experiences of these young people. And it was a prospective qualitative longitudinal study, which is a very long way of describing it. But we basically, to explain what we did in-depth telephone interviews with young people living across the country. And instead of doing it, some of you may have participated or ran studies where you just do single interviews. We were interested in looking at what this process is like over a period of time. So in order to achieve that, these 3 interviews took place after their primary treatment. So before they had returned to work or returned to work completely, 3 months later, and then 9 months later, and to look at their stories of what it was that they went through during this period of time and what that meant to them. For those interested in methodology, we used NVivo to manage our data, and we conducted thematic analysis, which is looking for shared patterns across people's stories. And we conducted 14 interviews for this particular project with 5 survivors. Notably, 1 didn't complete their 3rd interview, but all were diagnosed as young adults and ranged in age from 25 to 40 at the time that we first conducted the interview. And their diagnosis included Hodgkin's lymphoma, multiple myeloma, malignant neoplasm of the penile region, thyroid and appendix cancers. And from their stories that we collected over these periods of time, we found 4 particular themes that were prominent in their data. And the first was that young adults faced uncertainty about returning to work after a cancer diagnosis. And that can be because they may be in new jobs or precarious employment at their time of diagnosis. They may also be educated about the potential long-term effects or experiencing them and not know really what is this going to look like when I go back to work. When they say I may have brain fog or chemo brain, what is that actually going to look like for me on a day-to-day basis, and how is this going to affect my ability to go back to my old job? So there's great uncertainty kind of around that. Also, cancer may also be a catalyst for career change. So some people spoke to us about the fact that they felt, in their words, that their diagnosis was a wake-up call to them to find an employment that they deemed would be more meaningful. For some, this meant considering options in the healthcare field, having been in the healthcare system and seen their own healthcare providers. For others, this also meant returning to school or thinking about going back to school and pursuing different degrees in education. But as we all know, employment benefits are, of course, very important. And these can influence return to work decisions because they may influence what type of leave we've been able to have after a cancer diagnosis, and what sort of time frame we're looking at in terms of going back to work. Additionally, for some young people and for many people, their pharmaceuticals are covered by their health insurance through their work. Some people also spoke to us about the fact that they were worried that if they left their current job, they wouldn't be able to get employment benefits again, because they would be deemed to have a pre-existing condition, which may affect their ability to get travel insurance, and traveling was something that was very important to them. A fourth theme was that young adult specific resources are needed to support young people in their return to work. So many of the young people spoke to us about the programs that they had gone through and how beneficial they found it was to connect with others who got it, who understand what they were going through, but not only that, to learn about their experiences and what did they do that helped them return to work, and what were some tips and tricks that they would recommend. They also felt a need to reciprocate this support and to perhaps support other young people through their own process. So in conclusion for this study, we found that those earlier in their career and life course can see the diagnosis of cancer as an opportunity for change. And that's specific, of course, to the people that we interviewed. And young adult specific resources could potentially support young people in returning to work. Additionally, our use of longitudinal methods, so the fact that we interviewed people over 3 different time points about the return to work process, provided us with an in-depth picture that we're not sure we would have achieved if we had just interviewed people in a single snapshot. So for our second study, just kind of switching gears a bit and talking specifically about those living with a metastatic and advanced cancer, we conducted a scoping review this past summer, and it was on the experience of young adults living with metastatic advanced cancer, because while we have seen that the young adult cancer movement has advocated for and seen change for young people with cancer, those living with a metastatic advanced cancer have not been as equally advocated for their needs and programming. And additionally, when we look at the research, while there's little on young adults with cancer, there's even less on those living with a metastatic and advanced disease. But at the same time, the literature also tells us that the young adult, some of the research tells us that the young adult population has not seen progress in cancer survival rates comparable to that of pediatric and older adult oncology populations. So this is a historically marginalized oncology group that has not been reviewed comprehensively, which is why we did this project, because we wanted to see, and what scoping reviews do is they look at all the projects that have been published, and in our case, we looked at all English publications to map what is known about the experiences of young adults living with a metastatic advanced cancer. So just to look at all the different projects and to kind of condense and synthesize what it is that we know currently about the psychosocial experiences of young adults living with metastatic and advanced cancer. Now, I did cut out, just for the scope of this presentation, a lot about the methods of what we use to determine and how we developed our search strategy and our inclusion criteria and all that sort of stuff, because I definitely want to get to the stuff at the end, which is the resources that do exist. But I just wanted to give everyone an overview of what it is that we found from this project. So again, we mapped the current state of empirical knowledge for this research done in this area. But what this also does is it highlights gaps of what has not been researched yet, and what is potentially areas that we need to be looking at for research development so we can better support young people. And our research question was, what is the current state of empirical knowledge of the experiences of young adults living with metastatic and advanced cancer? So of all this, we found only 10 studies that met our inclusion criteria, and the majority of them were conducted in the United States, with a couple in Canada and 1 in Korea, and 7 of them involved a mixed group of diagnoses, so they'd be inclusive of multiple different primary cancers. And the studies were published between 2011 and 2018. But from there, we found 4 major themes of what has been published in the literature, and that's people have looked at the search to make meaning of their illness. So they've looked at the blogs of young people who have died of cancer to look at their meaning process there, and a prayer journal was a case study of another person that was looked at. They looked at their relationships with others but this was primarily with the health benefits of the oncologist-patient relationship and how they could see that there's health protecting behaviors that could come from that, like people would be more likely to adhere to their medication. And it also talked about young people who did a yoga intervention. They also mentioned the fact that if they could connect with other young people living with advanced cancer who are also doing this yoga intervention at home, that would perhaps provide great meaning for them. It looked at mental health and psychosocial well-being, and it looked at, there was one again study that looked at physical health, which was the possibility and feasibility of a yoga intervention at home for young people living with metastatic advanced cancer. But what we primarily found from all this was that the body of empirical knowledge is, of course, scarce in this area. There's not that much that has been published. And what has been published explored a really diverse area of experiences. So there's not one particular area that's been comprehensively examined. But in addition to that, there's 3 knowledge gaps we have in the literature, which is how do young adults experience cancer care or health services delivery? What is their relationship with their children and partners? So surprisingly, there was no research that we found that met our inclusion criteria, which again, I wasn't that explicit about just because of the scope of the presentation. But what is it like for parents who have received a terminal illness and they have young children? We know that, of course, that's very important. What's it like for their partners, for their parents, if they have their parents in the picture? Additionally, very few looked at how socio-demographics, so sex, gender, race, socioeconomic status, sexuality, all things that we know are important to health, how did these influence the experiences of young adults? And surprisingly, very few studies highlighted any of the socio-demographics of their population, and if they did, it was primarily a white female population. So I just kind of want to shift gears a bit here to talk about that's what we know from the literature, and that's the gaps that we do have in terms of psychosocial experiences. There's still a lot of work we need to do to define the needs of young people living with a brain tumor and cancer diagnosis. But right now, there are resources that do exist for young people, and one of them is online communities. And so we know in patient communities that, again, as we mentioned, there's a desire for young people to connect with others who get it, who understand what they're going through. And we know that this fosters support for them and that there are online and in-person options. Depending on where you live, you may be able to pick and choose which one is of more benefit to you. And also including supporters could help also foster this relationship too. So the first one I wanted to talk about, and there's many different health tag communities on Twitter. And if you wanted more information, you could go to simpler.com, which has a list of an ontology hashtag project, which can give you the list of all the different oncology hashtag communities that exist. There's ones for radiation oncology, many different ones. But the first one I want to talk to you about is the Brain Tumor in Social Media, which is a patient-run community that was founded and is moderated by Charlie, Liz, and Adam, whose handles are down here at the bottom. So they do run a chat for not just patients, and the ones that the hashtags I'm highlighting are not just patient communities. Patients certainly play a super important part of it, but they're also for healthcare providers, caregivers, advocates, anyone who has interest in learning more and talking about the brain tumor and social media community. So again, the first Sunday of the month at 9 p.m. Eastern, but also between these chats throughout the month, people tag their brain tumor related tweets on Twitter using this hashtag so that they connect with other people. So these communities do run, sort of 24/7 because they're used by different people around the world. And the recent topics that they've discussed have been quality of life, low-grade glioma registry, advanced care planning. So they talk about all sorts of different things that are relevant to the brain tumor community. The second one that I'll talk a little bit more in detail is ACSM, and that's because I co-founded it with Billy Paymaster of Hope for Young Adults with Cancer and Maureen Sweet, who's formerly of Stupid Cancer, both in the United States. And ACSM stands for Adolescent Young Adult Cancer Societal Movement. And basically, we started this hashtag 5 years ago, back in November of 2013, to really, and it sounds not as novel now because there's literally a hashtag for anything and everything. But back in 2013, we were finding it so great that we were going to these professional meetings and getting to connect with each other. But throughout the year, we wanted a more simple way of seeing each other's AYA, and by AYA I mean adolescent young adult related tweets, and sharing each other's resources and stuff just to make patients and other healthcare providers more aware of what was going on. And so when we started using this hashtag, it started mobilizing and connecting our global efforts in a way that really we didn't anticipate would happen. But it started being used by major oncology nonprofit organizations, also by Canadian Partnership Against Cancer, many different hospitals. And the funny thing was, last summer I was in Vienna, Austria at the Multinational Association of Supportive Care and Cancer conference, and I was sitting there listening to a talk, and they started talking about ACSM. So it's really had a reach that we couldn't have initially anticipated, but it was challenging, as hashtag communities do, traditional communication that we see in healthcare. So by using this hashtag, you have an ability to connect with all other people who are using it, which is a wide range of people, which I'll highlight in a second. But we do a monthly tweet chat in addition to this, just like the Brain Tumour social media community, which happens on the first Tuesday of every month at 8 p.m. Eastern. We talk about various different topics, including oncofertility, grief, and social media, and clinical trials, and all sorts of different things. This is a paper that we published back in 2016, if you're interested in reading it. I'll just give you a second to look at that, in case you want information to look it up later. And so this was headed by Dr. Perales down in New York City, and a few other doctors in the United States. And this is what we see. We started looking this year using Simpler to kind of look at what is it that we've done over the past 5 years and who is our community. And basically we have a diverse group of stakeholders. As you can see, 30% here is doctors, we have 15% patients, and then 16% organization advocates. I do want to highlight though that, people aren't just cut and dry one identity. Some doctors are also oncology brain tumor patients, may also work for an organization. So we really do have a diverse group of stakeholders who come out every month for the tweet chat to connect with each other and use the tag throughout the month. This is just, this picture of the map is also different places where the hashtag has been geotagged recently. And again, as of May of this year, we've had over 220 million impressions since inception, and trending terms have included life interrupted, bone marrow transplant, young women, fighting stage 4 cancer. It's been used by over 8,600 unique people and accounts, with over 25,000 visuals shared and 71,000 unique tweets, and been geotagged in North America, South America, Asia, Europe, Africa, and Australia. And I think that because it's lasted for 5 years, it clearly has value to the community. So Billy and I run this now with a huge budget of $0, and we just do it as volunteers. But the hashtag doesn't belong to us. It really belongs to the community and those who use it, and it wouldn't have existed if it didn't have value for people. And certainly we've seen over the years that it's fostered collaborations and patient engagement, and has had a really rich conversations happen between all different people. So while our approaches vary, Our shared missions are the same, which is, of course, improving the lives of adolescents and young adults living with cancer. But, someone said to me the other week, you're such a huge proponent for people talking about social media. But I also want to highlight that talking on social media is not for everyone. And there are certainly concerns that patients need to be aware of talking about their healthcare stuff online, and professionals as well, what they say and how they interact online too. But I just wanted to present it because I believe that, everyone's adults and some people choose to do that. But also some people may just be interested in looking up those hashtag communities and just following along and listening and reading it without having to contribute to it themselves. So that is a possibility for some people. We have many people who just read the conversations that happen online without also actively participating. And there's other resources that exist for young adults too. So some that I wanted to highlight, and I know the Brain Tumour Foundation of Canada is going to talk about their resources here at the end. And this is, of course, an exhaustive list of resources. If you are listed as resources, know that they do change because lots are publicly community funded. So what their offerings are may change. So go to their websites, look them up. In addition to that, go to the resources that they recommend too. And that will be able, because this is certainly not an inclusive list, but that will be able to allow you to snowball into finding many different things that are out there for young people. And the first one I wanted to talk about is we talked about return to work and the issues that can arise there and the uncertainties people face and the logistics of dealing with all these different things. How do you deal with gaps in your resume? How do you deal with the challenges that you may face returning to work? So Cancer and Work is a Canadian resource down here at the bottom that just started a few years ago. Up here at the top is Cancer and Careers, which is an American resource. But patients have told me that they found, even though this is written with an American lens, people do find benefit in reading the information that they have, especially addressing gaps in their CV and that sort of thing. So I just wanted to present you with those two different options. There's in-person support, depending on unfortunately, it's usually mostly in major cities in Canada, but there's different in-person support options, including Cancer Fight Club, which is at the Jewish General Hospital in Montreal, part of Hope & Co. There's Callanish in Vancouver. Young Adult Cancer Canada offers various in-person programs through their Local Life program. There's Gilda's Club in Toronto. Just want to leave that there for a second in case you want to write any of it down. There's also Pink Pearl, which is if you're a woman living in Ontario, maybe an option for you. There's Princess Margaret's AYA program. There's also Wildspring, which is in Edmonton and Calgary. In addition to that, there's conferences and retreats. As mentioned at the beginning, I am so thankful for the support of the Brain Tumour Foundation and the professional development grant I received last year to go present at CancerCon. CancerCon is a major global conference for young adults living with cancer that takes place in the United States each year, so that may be of interest to you. Lots of people talk about their desire to do activity-based, adventure-based programming. So if that's of interest to you, you may want to check out First Descents, True North Treks, and Project Koru, which are all in the United States, but they all, at least the last time I checked, do take Canadian participants. There's also Cancer Fight Club, which offers retreats, and Young Adult Cancer Canada, which has both retreats, adventure-based retreats, and they also offer an annual conference. And there's Survive and Thrive Cancer programs too, which offers adventure-based programming and other things. So check out their website for their most recent offerings. And so in recap, what I hope you'll take from this presentation is that young adults 18 to 39 face unique psychosocial challenges. But one of the big ones that keeps coming up in the literature is a feeling of isolation. So there are online and community resources that can help bridge this gap for young people. That include the Brain Tumour social media hashtag, the Brain Tumour Foundation of Canada, who will talk about their offerings, Young Adult Cancer Canada, and our hashtag, which isn't a support community, but it's just an online community for anyone who is interested in adolescents, young adults, living with cancer, living with brain tumors, everyone. And I just want to acknowledge my PhD funding. In addition to that, if anyone has any questions, please feel free to reach out and contact me. If you have questions about the specific programming that's offered, contact those programs directly, because they'll be able to tell you what they currently offer and how you can get involved. But thank you so much for listening to this presentation today.
Thank you, Emily, for taking time out of your busy PhD schedule to be with us today. You have provided such great information, and it's so good to hear and to see the amount of work that has been going on for young adults with cancer across Canada, and the work that you're doing and the research that you're doing. I will mention Robin Urquhart is also a board member of Brain Tumour Foundation of Canada. You're doing some work with her as well, so that's amazing.
Yeah, she's my PhD supervisor.
Oh, I didn't realize that. That's awesome.
Yeah, she is. She's wonderful. Yes.
Yes. So what I'll do is for the people listening into this presentation, the websites that you provided and the different programs, we'll put it together like a one-pager and send that out to everybody who registered for this webinar, and then we will include it on our new website that we're going to be launching this fall. And I'll also mention that Todd Gould, our support services specialist, will be talking in a few minutes about the programs that we have here for young adults through Brain Tumour Foundation of Canada. So thank you again, Emily, for pre-recording this webinar for us and with us. And good luck with everything moving forward with your PhD.
Thank you so much for this opportunity.
You're welcome. Take care.
Bye.